Hello everyone, this is Dr. Montana speaking. Today, I want to talk with you about something that's not often discussed in everyday health conversations, but it should be. It's a vitamin that most people don't even know exists, and yet it plays a vital role in protecting both your heart and your bones. It's called vitamin K2. Now, you might be familiar with vitamin K1, the one that helps your blood clot when you get a cut. That's important, of course. But vitamin K2 works in a completely different way. And it does something truly fascinating. It helps your body use calcium properly. Let me explain what I mean by that. We all hear about calcium. Take calcium for strong bones, right? But the problem is, just taking calcium isn't enough. In fact, without the proper guidance in your body, calcium can end up in the wrong places, like your arteries, and that's where trouble begins. Vitamin K2 acts like a traffic director for calcium. It helps move calcium into the bones and teeth where it strengthens your structure. It helps keep calcium out of the arteries where it can cause hardening of the vessels, also known as calcification. When your arteries become stiff from calcium buildup, your blood pressure goes up. Your risk for heart disease, stroke, and even kidney damage increases. But when you have enough vitamin K2 in your system, it activates special proteins like matrix GLA protein, which actually work to block calcium from depositing in the arterial walls. Now I want to share something from the medical research that really caught my attention. A Danish clinical trial looked at people who already had some calcium buildup in their arteries, something we call coronary artery calcification. One group received a high dose of vitamin K2, specifically a form called MK7, along with vitamin D3. The other group received a placebo. The result? The group that received vitamin K2 had much slower progression of artery calcification compared to the placebo group. That means their arteries stayed more flexible and open, reducing the risk for major cardiovascular events. And this isn't just one isolated study. A large meta-analysis, which means a summary of many high-quality trials, showed that vitamin K supplementation significantly slowed the progression of arterial calcification across multiple populations. That's an incredible finding. Imagine a vitamin that can help keep your arteries younger and more elastic simply by telling calcium to go where it belongs. But the benefits don't stop there. Let's talk about bones. For many people, especially women after menopause, bone health becomes a major concern. Osteoporosis or thinning of the bones, fractures, shrinking height, these are real issues that can seriously affect quality of life. Now, most people are told to take calcium and vitamin D for bone health. I always do that for my patients. And those are important. But again, without vitamin K2, the calcium you take may not get incorporated efficiently into your bone tissue. Vitamin K2 activates another key protein called osteocalcin, which helps bind calcium into the bone matrix, literally strengthening the bone structure from the inside out. So again, the vitamin K2 activates a key protein that helps bind calcium into the bone structure, strengthening the bone structure. In one meta-analysis of randomized controlled trials, women who took vitamin K2 showed improvements in bone mineral density, especially in the spine and forearm, and a significant reduction in fractures by up to 57%. Another long-term trial from Japan used a form of vitamin K2 called menatetrinone given at 45 milligrams per day. This showed reduced vertebral fractures and better bone density in elderly patients. So that there is hope for our elderly patients and our seniors. So you see, it's not just about avoiding deficiency. It's about optimizing your body's ability to handle calcium wisely. That means stronger bones, fewer fractures, and lower risk of calcified arteries. And that translates to longevity of life. Now you might be wondering, okay, Dr. Montana, where can I get vitamin K2 in my diet? I'm glad you asked. The highest natural source of vitamin K2 is something called natto, a fermented soybean dish popular in Japan. It has a very strong smell and taste. Not for everyone, but it's incredibly rich in MK7, the most active form of K2. Other excellent sources include aged cheeses like Gouda and Edam cheese, egg yolks, especially from pasture-raised chickens, unpasteurized sauerkraut, kimchi with cucumbers for those who love Korean food, grass-fed meats and butter, and for those who don't mind organ meats, chicken liver and goose liver are excellent as well. Personally, I prefer to focus on fermented foods. I like to add a scoop of sauerkraut or a spoon of kimchi to my meals. It's not only a great source of K2, but also helps promote gut health, which is closely linked to your immune and metabolic function, and even better skin. Now, what if you don't like fermented foods, or you're not just getting enough in your diet? In that case, you might consider a supplement. Look for vitamin K2 in the MK7 form, often paired with vitamin D3. That combination supports both calcium absorption and proper distribution. Just remember, if you're on a blood thinner like warfarin, talk to your doctor first because K2 can affect how your medication works. Okay, now let's take a moment to summarize. Vitamin K2 may be one of the most underrated nutrients in your health toolbox. Research shows that it helps reduce calcium buildup in your arteries, supports strong bones and teeth, decreases your risk of fractures, promotes better calcium metabolism, and may even support brain, kidney, and metabolic health. That's a lot of benefit from one simple vitamin. So what can you do today? Start by including more K2-rich foods in your diet. If you're open to fermented foods, try sauerkraut, kimchi, or aged cheese. If you're curious about natto, give it a try, but don't say I did not warn you about the flavor. If you're considering a supplement, look for one with MK7. Make sure it's third-party tested for quality. Most of all, remember that good health isn't about doing everything perfectly. It's about consistency, balance, and giving your body the nutrients it needs to function at its best. As I always say, good health leads to a meaningful, vibrant life. This is Dr. Montana. Thank you so much for listening. If you found this helpful, feel free to share it with someone you care about or ask me your questions next time you see me. Take care of yourself, and I'll see you next time. This is Dr. Montana speaking.